Hi, everybody. Welcome to your first module slash PowerPoint presentation in your nursing in the Canadian healthcare system. My name is Kim Ellis. We met on orientation day, and I'm going to take you through, take you through all of the content that speaks to the components of the Canadian healthcare system. There's many pieces of our system specifically that not everybody knows. Even if you are a born Canadian, there are pieces to our healthcare system you wouldn't necessarily know, little bits of our history you wouldn't necessarily know, and definitely those of you in the class that are international students that have come to us or you have immigrated to us, in the last several years. The reason we need to know these things is to give a little bit of a perception and a little bit of understanding from the point of view of a healthcare provider and what the health system is like for us, for our coworkers, and for our patients. So this very first one is really going to talk about the healthcare system itself, the pieces of the healthcare system, and a little bit of the history of how we came to be who we are. So let's just move on to our next slide. So the first thing that we're going to talk about is Medicare. It's also called the Canadian Medical Program, but Medicare seems to be the standard shortened version that most of us are familiar with. So let's just talk about Medicare in general. Why is it so special? You hear that through the world. Canadians are very blessed or very fortunate to have a free system, a free access to many things, which is true. But it's not all free sometimes. So we're going to talk a little bit about that. And first of all, why we are so blessed to have Medicare to start with. So the movement towards having some sort of a government-funded, country-funded healthcare protection began after World War II. And if you can think about the impact that the healthcare system would have had as the men came home from war. Some of them would have come home through the war injured. A lot of them came back from the war disabled, permanently disabled, maybe didn't receive the greatest healthcare treatment on the battlefield and also in the hospitals across seas. So we were left with a system that got overwhelmed with a lot of returning men that needed care. So that is when the talk about this started to happen. When Medicare first did take place, actually happened in just one province in 1945. So again, we're talking post-war. And Saskatchewan, the province at that time, was run by the Premier Tommy Douglas. And they implemented the very first medical plan covering just welfare recipients. So people, of course, welfare then is the same as welfare now. So those are socially funded people that don't have any other means of employment. And not employment, pardon me, income. That started I wouldn't say a revolution, but a movement like, hey, how come these people are allowed to have it and we can't? We're all Canadians. This is a great idea. We pay taxes. Our men have come home from war. We need more support. So in 1947, Saskatchewan again established the very first provincial-wide universal hospital insurance program. And it was specific to hospital care to all of the residents of Saskatchewan, and it was funded through taxes. And that was thanks to Tommy Douglas, who was the Premier of Saskatchewan at the time. And Tommy Douglas is known through literature as the father of Medicare. Now, this was not something that went over well, especially with the physicians. Up until that point, physicians were paid fee for service. And what that means is you came to their office, you paid them for that visit. They do a treatment on you, they pay you or pardon me, you pay them for that treatment. And that is how they got their money. It was a business. So everything that they did for you, you paid for. So of course that was a threat to that. The taxes were now paying for part of that, and the doctors were not happy. And what actually happened is the doctors went on strike. They went on strike for 3 weeks. There was large protests. If you ever go onto the internet and look back through, you're going to see quite a few pretty powerful look pictures of people in the streets boycotting and speaking against this system. But eventually, as you know, government got involved, the heads of hospitals, different people in the healthcare industry, doctors themselves, they started sitting down and talking about, pardon me, the impact of what this would mean for physicians, for the public, for the hospitals. They eventually came to an agreement in 1961 that there was a healthcare insurance plan in place for all provinces and territories. They weren't the same, but each province and territory had their own plan that they could make available to their residents of their province. And in 1966, so if you look at the timeline, 1966 officially the Medical Care Act was introduced, and that basically sealed the fate of all of that work, that it's here to stay, that Canada's publicly funded healthcare system is now legislated. It's an act through the government, and it is funded and monitored by the government. So if you look at that, what is that? That's almost 20 years. That is 19 into 20 years of work. So it took some time. It took a lot of buy-in. It took a lot of people figuring out the rules, the policies, how things were going to play. And still today we're benefiting from that work that our people did in the 40s, 50s, and 60s. So as of today, each province and territory still manage their own Medicare system. So for example, we have the Medical Care Act that is federal, and each province would have their own Medicare department as part of the Department of Health. So we have our New Brunswick Medicare system. Underneath that Medicare system, we're going to talk about that in a bit. There's some requirements that each province is to offer their residents so that it's uniform, so that you couldn't say, you know, hey, Alberta has a better plan than New Brunswick or vice versa. There's some fundamental things that every province is to ensure their residents have access to. And then if there's anything different that is specific to that province, the province can decide whether it's going to be included as part of their Medicare package. And the main reason that the Medical Care Act was felt to need to be passed and then became law in '66 is that it guaranteed then reasonable access for all Canadian citizens without having to pay out of pocket for their medical expenses. So that was a lot, I know, but that little history kind of makes everything make sense, doesn't it, as to why, you know, we are blessed to have this system in place. And it really has to do with Tommy Douglas, the Premier of Saskatchewan at the time. So with that being said, who qualifies for Medicare? One thing about Canada is they call us a melting pot society. It's an old expression, but what that basically means is we open our doors to immigration and refugees, and we also support various cultures, and we were founded by different cultures. You know, the roots of our country are from the European side. So it's very much a question of, well, who qualifies? If I move to Canada, do I automatically become part of their wonderful Medicare system? So of course there are some maybe rules, restrictions in place to protect that and just to make sure that the system is being used by those that really qualify. So first of all, Canadian residents, and that means Canadian born. So myself, I was born here in St. John. I still live in St. John. I will probably die in St. John. This is my home, and I am a Canadian born resident. And then we have people that have permanent resident status. So it's like, what does that mean, permanent residents? Well, these are citizens of other countries that are allowed to live here without having to gain a Canadian citizenship. So you've lived here for 25 years. You still are considered a citizen. Let's just pick France. You're still a citizen of France. You moved to Canada. You've set up your life here. You've had children here, but you've never taken that extra legal step to gain your Canadian citizenship. You still qualify for Medicare in the province that you live in. Okay? Then you have immigrants, and I will just say immigrants is really an umbrella term for anybody that's migrating into Canada for whatever reason, whether they're, running from war, whether they're refugee, or whether they have decided that they're going to move and make Canada their home. They go through a waiting period. It's taken care of course, by the Department of Immigrations. And there's a certain waiting time. Now, the waiting times vary per province, but the maximum really that they're going to wait to have to get their Medicare is a maximum of 90 days. Every province is different. And you know what? I meant to look up to see what New Brunswick's was when I was making this PowerPoint a couple of weeks ago, and I forgot to. But again, I feel 90 days makes sense because it's probably going to take them that long to process paperwork, to get into the system, to make sure that, they are who they say they are, they've brought who they say they've brought, and all of that paperwork is in place. Okay. This picture here that is on this slide is also in your module. It's a little bit bigger, but I really liked this. It came from the Canadian website, and it really gives some of the things we're going to talk about, why healthcare in Canada is so notable and what are the major benefits. The first one is it's affordable. It's free. There is so much of the Medicare system that is free, and it's through our taxes, through our income tax that we pay. And it's also, I think, through our sales tax, that a little bit might go there, but taxes in general, certain amounts of it are going to be shifted off into the healthcare sector. Yes, we do still have to pay for some things, but they are significantly reduced in cost. And I feel that most of those things that we may have to pay for, so for example, some physicians have little procedures that they would do in their office, like removing a mole. So that may not be covered by Medicare, but it would be covered potentially by your private healthcare insurance. And I brought my coffee with me today to keep me going on my lecture. So that's one part, the affordability. Along with the affordability is the fact there's a wide range of services. So remember when I talked about the history and I said in the beginning it was only for those people who were requiring hospital services. Now it's broadened out. It's any type of health care that you need at all through the country and in your province. Portability, so what that means, we're going to talk about that a little bit more because it's also one of the pillars of the Canada Health Act. Meaning, if I travel to Nova Scotia and I break my leg and I have to go into the Nova Scotia hospital, my New Brunswick Medicare is going to pay for that. I myself have had 2 surgeries in Halifax, at the Halifax Hospital, at the Victoria General Hospital, and my Medicare paid for that because the doctor that I needed for that surgery worked there. They didn't work here. So that's what it means by portability. I can take it with me. Now, the billing happens behind the scenes. You give your Medicare number. They're going to say, hey, New Brunswick, Kim Ellis is here, and we had to do these procedures, and it was a $5,000 Medicare bill. So, here's the bill and pay us back. That's what it means by portability. No money changes hands with the patient themselves. The other thing with the Healthcare Canada, because it is funded by the government, the taxes come from the paying public, so they have an expectation of standards. We do have high quality healthcare. Some provinces it's different than others due to the fact that they have a higher population, therefore they have more tax money to invest into the system. But it does create a high quality and standards are followed, and the government is part of that, keeping track of what is being offered in the country. The other thing is it does provide options. So healthcare in Canada is universal. That very first statement in that bullet is so important to understand because it means that the healthcare coverage is not limited to partner doctors and hospitals, that you can consult with a doctor that works best for you. The best example for that is our patients across the country that go to Ontario for transplants at the London Hospital. So in New Brunswick, we do not have a transplant center, but would New Brunswickers be held back and not receive that service just because where they live, they don't have a doctor to offer that service? Absolutely not. It provides options. If the doctor isn't here, we can get you to doctor somewhere else. So for example, that is why my surgery happened in Halifax. I needed a certain procedure and I had one here and it wasn't as successful as they hoped. The next level of the procedure was performed by a doctor who worked out of the hospital in Halifax. So I was referred by this doctor to that doctor, and my healthcare needs were transferred from one province to the other, one doctor to another, from one hospital to another. So that's what that means. We have lots of options. And the last thing is it's fast. Now, some people might argue that with you, that there are lots of waiting lists for operations. There's lots of waiting lists to see a specialist. But basically, what they're saying is the fact that Medicare exists, the funding to have facilities available and equipment available, and to keep everything as high tech as they can is due to the benefit of the Medical Care Act and the fact that Medicare is a government initiative. So again, bullet number 6 isn't always a popular one, but that was the hope, one of the benefits of the Medicare in Canada, healthcare in Canada. So on to our next little topic. So we're going to talk about Health Canada. You're going to hear Health Canada mentioned in a few of your courses going forward. And at this point, and you may have already heard of Health Canada and some of the things I'm going to talk about, the beautiful thing about this, I guess with COVID, if I could say there's positives, COVID did make Canadians more aware of some of the different roles that our healthcare system is involved in, such as research. That would be the big one, and infection prevention and pandemic responses, all of those things. So I think it's really nice. This is part of our lecture when we teach you about the healthcare system. But what exactly does Health Canada do? Who runs Health Canada? How do I talk to Health Canada? What does that mean? So we're going to delve into that in the next 2-3 slides. So first of all, I'm just going to read directly the quote that is from your module as well, that Health Canada is responsible for helping Canadians maintain and improve their health. As simple as that. It ensures that high quality health services are accessible and works to reduce health risks. So they're the part of the government that keeps their eye on the healthcare system for the government. They're their own department. It is a system that Canadians can afford. We talked about that. It's free. And if it isn't free, you should have added funding to help you. The other piece that the Health Canada and our healthcare system does is addresses what we call the determinants of health. You are going to be learning about these as you go through the courses, and we're going to talk a little bit more later in this course. So when we start talking about determinants of health, those are 12 lifestyle pieces that have been determined to be important to keep healthy, to maintain a healthy life. And they are healthcare policy is based on the determinants of health. So I'm bringing them up here. We're going to study them later, but remember this when we do bring them up, that Health Canada uses the determinants of health to decide policy and to decide where the money goes and what's important to research on. Health Canada supports a primary health care system. So what does that mean, Kim? Well, primary health care is the health care you can access as a person, as an individual. So some of those examples are below. It would be your family doctor. They're part of the primary health care. They work within the system. And they are definitely, what's the word? You're almost your first line or your first person that you would access to get in. Your nurse practitioner would also be there as well because they can hold a practice. Nurses in general, and I use that term lightly, whether you're a personal support worker, a licensed practical nurse, a registered nurse, and again, nurse practitioners, they're part of the primary health care. We're on the front lines. We're within those funded facilities that the Medicare system is paying for. Home care specialists are part of primary health care. So think of primary meaning your first. We now have people that go into your home and take care of you. We did through the years, but not at the expansive nature that it is now. You know, people can gracefully die at home. People can live on ventilators at home. And we can have anything from a person needing help for 2 to 3 weeks after surgery to needing a physiotherapist to come in and help them with some rehabilitation, or you could be accessing the extramural hospital system in our province and have a nurse visit you fairly often. So that's what we mean by home care specialists, and that is now part of our primary health care. That is funded, that is given to you, that is something for you to have on the front lines to improve your health. And then just really to put that out there, other healthcare professionals who work to maintain health and treat illness. So there's lots of funded things. For example, physiotherapy. You can have it free within the hospital. You can go to clinics where you can get some funded through your private healthcare, for example. So there's many other health professions. We don't need to go through them, but you have to just realize that some people still think it's just the hospital, but it's not. It's much bigger than the hospital. And in 2023, we are in the community more than we've ever been. So it's important to understand that is also funded in part of the Health Canada primary program. My bullet didn't go right there, but where it says aim to provide coordinated community-based care for a wide range of health concerns. That's the goal of primary health care. Is to primary meaning you're in the hospital, you go to your family doctor, you're sick, you get admitted to the hospital, you get better in the hospital, but you still need a little help at home. So the care comes with you to the home. So it's a very fluid, sometimes, system that care will follow you where it needs to go. It's basically what that bullet means there. And the other thing with Health Canada is their role is to set. So that means set up, develop, implement and administer national principles for the healthcare system. So remember I said each province under Medicare may have a little difference here and there compared to maybe the province next to them. But nationally, they have to follow the national stuff that was set forward by Health Canada. This is through the Canadian Health Act, which we're going to talk about, and by delivering healthcare services to specific groups, which we're going to talk about. So, that might seem a lot. You think, gee, I'm in a big history class and this is supposed to be nursing, but you're going to be working in this system. So it's kind of nice to know where you're going, where you're getting at, and to see who supports it, where the money comes from, and exactly what our patients will experience when they do enter the healthcare system. What is there and available for them? So this is a busy slide, and I copied this directly from the module. I was going to edit it, and then I thought, no, I think it's important for us to really look at these little wordy bullets and understand exactly what they mean. Because Health Canada, think about Health Canada as the father, and all of the provinces are the children. Okay? Health Canada works with the provinces to also come up with any standards, any policies, any healthcare treatments that a specific province says, hey, we are specific to this in Ontario. So think of the transplant team again. So between Health Canada and the Ontario Medicare system, there would be some sort of a bridging contract understanding of funding specific to that program for Ontario, because we do not have that in New Brunswick. So I thought, and you're thinking again, Kim, why do I need to know this? Well, you do, because it gives you a sense of the politics that sometimes impede or advance where we work and where we live. So Health Canada will work with the provinces and work with the territories. And when that partnership happens, this is what should come out of it. Both entities are supporting the healthcare system, and they will do that through initiatives such as human resources, adopting new technologies, and primary health care delivery. So what that means is the provinces and Health Canada work together to make sure the residents of those provinces have access to what they need to have to deliver health care. So they support that. There's none of this, well, there probably is, but the whole premise is, if they need funding for this and this and this, then there's a partnership. Okay, how can we make that happen? They wouldn't say, well, the other 9 provinces don't need it, so you're not special, so you're not having it. It's not that type of support. So there's an understanding there that this is going to happen. The other piece of that is Health Canada has huge health promotion and health prevention, and that is also adopted by the Medicare systems of each province. Those two concepts we're going to talk about in greater detail in the course. Why is health promotion and health prevention a role of Health Canada? And the basic reason for that is if we can get involved in each person's lifestyle from a healthcare point of view, we can make people healthier, therefore make our communities healthier, therefore make our country healthier. So that's one of the things that they do together. Health Canada also provides, now these are big words, but we're going to say them. I'm going to explain to you what that means. Surveillance, which is a type of research. Prevention, again, is research. Control and research of disease outbreaks specifically, so hello COVID. across Canada and related areas around the world. As we go through our programs here, you're going to hear more about the World Health Organization. We're going to talk about public health here in a minute. You know, there's many places in the world that we receive research from, we receive ideas from, we receive direction from, and those are implemented within our healthcare system. Even though it's the Canadian healthcare system with Medicare, there's other influences out there that help us to build what we have. So that's what that bullet means. Monitoring is part of it. So again, it's about monitoring for disease outbreaks, monitoring for, the success of maybe immunization protocols. It has to do with drugs and foods and chemicals and pesticides and medical devices and really any consumer products across Canada. There's a division of Health Canada that looks after that stuff to keep us safe so we don't get sick from the things we consume and we don't get sick, hopefully, from the things in our environment. There's also a huge communication piece for Health Canada that they are required to keep their Canadian citizens up to date about health promotion, disease prevention, safety messages. They're involved in labeling, making sure there's warnings on labels for things. And they also provide, news conferences. If you go to the Health Canada website, there's all kinds of news releases and policy updates. And it's constantly being updated. If you're on there today looking at things, you could easily go on there tomorrow and there's been an update. So it is a site that is constantly current with the information the Canadian public needs around health. They also work with managing healthcare costs. So think about that a bit. They're the ones with the purse strings. They're getting their funding from the federal government. So they also have a responsibility to be frugal with our money, to try to give us the best that we can with the least cost that they can manage. And part of that healthcare cost as well goes into managing that health promotion and prevention. Are you starting to see that theme? It's huge about health promotion. If we can teach people to be healthier themselves, they're not going to need the healthcare system as much. That's basically the very bottom line of healthcare prevention and promotion. And the last thing is partnerships. Health Canada doesn't work by itself. It has an obligation to us to bring Canadians the most current, the most valuable, the most applicable stuff for our world, part of the world, our climate, our cultures, our different cultures that we've blessed into our country. All of those things Health Canada does have a role in because they want to make sure the right people are at the table and that groups of people, and we're going to talk about that a little bit more about culture, that they're represented and we're not missing anybody when we're providing these services to everybody. And you'll see here on this bullet that two of the biggest, and actually I can say three of the biggest at-risk groups in Canada that you're going to hear talked about a lot are the elderly, children, and our First Nations people, our Indigenous culture. So that's what that means. So I know that seemed daunting when you first looked at that slide and thought, oh, busy, busy, busy. She doesn't even have a picture. But I wanted to spend time to understand, that is a huge thing. Health Canada isn't just the purse. It doesn't just open it up and give us the money. They are responsible for many aspects of healthcare other than the financial piece. So let's just do a real quick little history lesson again. It's not that I'm a big history buff, but I think part of it is so very interesting when you see how things come to be. So the Department of Health, which is where Health Canada lives, was actually created in 1919. So just kind of think about that date. Medicare itself didn't come into play what's the word I'm looking for, until well, it was 66 when the Medical Act was passed, but in the 1940s when Medicare came to the provinces. So you're like, I always would think, well, what were they doing before then? What was Health Canada? Sorry, just a moment. I'm getting back feed there. Um, Really, all it was, I think back then, was more financial. What happened is they just took over the healthcare responsibilities of the federal government while they collaborated with the province and the territories. It wasn't as big of a hitter, or it didn't have as much power as it does today. But what was interesting, that in the 1940s, and I remember my mom talking about this, that they renamed it the Department of National Health and Welfare. And doesn't that sound almost very, very ominous? And it wasn't like Health Canada that it is today, or the Department of Health. We use those interchangeably. It was mainly a department for, let's just say, the underprivileged, the people that are on what we would call welfare. That is when they used to have food stamps. They used to have public health programs that you could enroll in, but not everybody went to them, and you had to apply. It was the beginnings of things. But again, in the 40s, that's when the shift to we've got to be more accessible to everybody happened. So today, what I want you to know, mainly, your history lessons I'm never going to really test you on, but I want you to see the evolution of where we've come today. And what the federal government does, it continues to be responsible for those things, but they also have taken over. It's not just the civil servants, it's also the armed forces. Back then, it was the Department of Defense that would do healthcare things for the armed forces, for example. So if you think about it, it's civilians, which is us, and then the people that are in jobs of service. So the armed forces, the RCMP, veterans are taken care of after. People in our prison system, in our corrections, are qualified and go under Health Canada. Our Aboriginal communities and selected refugee groups. Again, it's huge, but it's everybody. Everybody's included. So it underwent many names. Just as I said here, it was the Department of Health, and it was the Department of National Health and Welfare, and ever since the late 1990s, and I was actually nursing when that change happened, it became known as Health Canada and still stands as Health Canada today, with a very big role. So what are those roles? These are the big ones, and underneath all of these, there are many minor or mini departments that exist to make sure these things happen. But understand, first of all, the role of Health Canada, right in the very center of this, is the healthcare system. They are the father, and they monitor it, and they're part of developing our health policy, making sure funding goes to the provinces, all of those things I've just said on the last slides. They are the monitor of and keeper of the healthcare system as a whole. Pieces of that: product safety. We talked about that a little bit on a slide. That has to do with I'll use the word FDA. You guys probably hear that more than you do for Canada. The FDA is the Federal Drug, Agency, Federal Drug Agency of the United States. Every country has their own safety standards. Mainly the safety of packaged materials, the safety of things being developed and used for human consumption, etc., etc. Health Canada in Canada oversees that piece. They're also involved in environmental, so that's outside of us, and in workplace health. So you will hear about occupational health. You will hear about WorkSafe New Brunswick. Those are the types of things. Those are part of our health system and are government funded within each province. The other big role of Health Canada is monitoring, maintaining, preventing, promoting healthy living of their citizens and managing health concerns of our population. Drugs and health products, so specific to product safety, there's a separate division that has to do with drugs and health products. So in other words, makeup, shampoos, those types of things. It's all under the product safety, but it's a special division. And then there's the Department for Food and Nutrition. And again, we consume, so there's standards for refrigeration, for the types of foods that we feed animals that we potentially are going to consume, about the pesticides we would spray on our crops. All of those things are under that. So why this is here is this, to me, this is a really nice little diagram. Health Canada might make you just think health. That has to do with, going to the doctor, visiting the hospital, going to the emergency room. But Health Canada is involved in more than just our health. So this is a beautiful, beautiful little slide. I love it, just to give you an idea. So let's talk. I don't expect you to memorize these. I'm going to tell you this straight off. I want you to be familiar and understand these words, because guess what? You're going to be coming across them in your practice. You're going to come across them, if you get involved in a community event, even in your own life, depending on what diseases impact your family, different things like that. And it's really interesting to me that people don't know that these exist. But Health Canada, as I told you on the other slides and whatever, they have different departments. So we have the big umbrella, Health Canada, and under Health Canada are some pretty powerful departments that manage those pieces that I just talked about on the previous slide. So the first big one most of you have heard, is the Canadian Food Inspection Agency. So these are the people that can go in and shut down restaurants. These are people that can shut down manufacturing plants if they're not following standards, because they're to maintain, they're to monitor that food is being prepared, for lack of a better word. Food goes anywhere from vegetables to meat to dairy to processed to all natural, that it's safe for human consumption. That's the easiest way to say. And when we see that zoonotic diseases, that has to do with animals that would be consumed. Okay? So vegetarians, vegan, people that do eat meat in their diet, no matter what your diet is, anything that is processed and taken care of by another manufacturing company, for example, a farmer, whoever it may be, has monitoring systems in place under the Canadian Food Inspection Agency. And this also goes for foods that are imported in. Pretty simple. Then we have this really cool department that we don't hear about much, but their work impacts and enhances the healthcare we're able to provide for our population and ultimately for our patients coming in the future. And it's the Canadian Institutes of Health Research, and they are the federal health research agency. Each province probably has all kinds of research departments. Even here at NBCC in the health division, there's research projects that go on all of the time. But this is the federal one, and this one is really focusing on the directives of Health Canada. What are the things that we need to do, and what research do we need to do to improve the health of our population? So in other words, what are the diseases that are plaguing us? What are the unhealthy lifestyles that are plaguing us? What about the environment? What about the atmosphere? All of those things as it applies to health. They also do research on health services, health products, any of those things. They're involved in, is it good, is it bad, how much are we going to use? They develop things, they may analyze things, but they've got a big role in those types of things. And ultimately, their goal is to strengthen the healthcare system from a research point of view, to give us the best evidence of the best options of treatment, of equipment, of services that we can use in our daily life. Health Canada does have its own little department within Health Canada. It seems silly, and it really should have been at the top. I'm out of order here. But again, Health Canada itself is responsible for helping Canadians maintain and improve their health, and it respects individual choices and circumstances. So that is why all these other departments are there to help us make good choices. They may not be the best choices for us, but to give us at least a fighting chance of having good agencies working with Health Canada to keep our health a priority. I sound like an infomercial. This piece of Health Canada I wasn't real familiar with, to be honest, when I was getting this lecture ready, but once I did, I realized, okay, that makes sense that there's a specific place for this. They're called the Patented Medicine Prices Review Board, and that's hard to say. But basically, they are the people that are making sure consumers are not being gouged by medical stuff being overpriced so that we can't afford to get better. That's a real simple explanation of what I've read. Okay, so not only are there people in place like under the Food Inspection Agency, and then we're going to talk about public health, all of those people in place to make sure the products that we use are safe, etc., etc. And we have research to back up their use and their benefits. But we also have an agency that's going to make sure that the pricing of them is fair. So I sort of read that and thought, well, gee, that makes sense. that would be part of Health Canada. And the last one is the Public Health Agency of Canada, which is an agency I feel we've all gotten more familiar with, even myself as a registered nurse for 34 years. The role and the power and the impact the Public Health Agency of Canada has for the health of Canadians as they led us through this pandemic. Taking the COVID out of your head, just in general, the Public Health Agency of Canada, their main mandate, so their main goal is to help protect the health and safety of all Canadians. And Canadians, loosely, basically anyone who calls Canada their home, no matter what your citizenship status is. We talked about those earlier. Their focus is preventing chronic disease and preventing injuries. So they're very much involved in our work safety and our occupational safety, in the immunization programs in each of our provinces. And also they're in contact with the World Health Organization when it comes to worldwide illness and disease that can become widespread and become pandemic. And that is where we saw them, really rally to action and really saw the research and the scientific piece of all of these agencies in Health Canada come to the front. And we learned so much more about statistics and the different types of vaccines and the different types of variants. And, we learned lots of things, but all of that was done to protect us and to keep us safe. So I think that's the greatest example any of us now are going to be able to reflect on. If before we would read that and say, oh, but yeah, what does that mean? That health and safety of Canadians, blah, blah. Now we know. They were the ones that rose to the spotlight when the pandemic hit our shores in March of 2020. And they also respond to public health emergencies and infectious disease outbreaks. So again, not just COVID. If any of you are familiar about the neurological disorder that the outbreak in northern New Brunswick that they have been unable, it's been going on now for a few years, actually before COVID, maybe about the same time within that year. They'll deal with that. They're going to get their epidemiologists in there and take samples and try to figure out like where it's coming from, what's it doing in the body, what can we develop or research to get rid of this problematic disease. And health emergencies, again, those are let me just think about, okay, so Kim has to go back. So we had the SARS outbreak in the 80s, different things. They were part of the HIV AIDS epidemic, pandemic. There's different words for the AIDS crisis that also started in the 70s into the 80s. So they're involved in those as well. So they've got a big role and they've got a lot of departments that work underneath them. So again, just another slide of information to show you the depth of Health Canada and why we are so blessed to have this system in our country.